Arthroplasty. The surgeon carried out an arthroplasty on the elderly man who had a fall. Arthrectomy. Due to an infection in the joint, the doctor suggested an arthrectomy. Arthroscopy. Arthroscopy is a minimally invasive procedure that requires a variety of lenses and a video camera. Tracheostomy. Tracheostomy is performed to ensure that a breathing tube has direct access to the windpipe. Cardiomegaly. Based on the chest x-ray results, it is clear that the patient has cardiomegaly. Hemostasis. After a cut, hemostasis occurs, which is the body's attempt at stopping the flow of blood. Retinopathy. A group of people that retinopathy affects is those that suffer from diabetes. Arteriostenosis. Certain controlled substances can cause arteriostenosis by vasoconstriction. Carcinogenesis. When healthy cells undergo a detrimental mutation, carcinogenesis occurs, transforming them into cancer cells. Bronchoscopy. Due to the patient's persistent cough, their healthcare provider recommended a bronchoscopy. Retroperitoneal. Kidneys are retroperitoneal organs as they sit behind the abdominal cavity. Hepatomegaly. Jaundice is a possible sign of hepatomegaly. Pancreatoma. The pancreatoma affected the patient's regulation of insulin. Cholecystectomy. Due to the presence of gallstones, the surgeon performed a cholecystectomy. Ischemia. The paramedic induced ischemia when he tightened the tourniquet too much. Adipocyte. Overeating and physical inactivity can result in a high adipocyte content. Anhidrosis. Despite running a marathon, an individual with anhidrosis could produce no sweat. Gastroplasia. The patients with gastroplasia reported unpleasant symptoms like nausea and vomiting. Meningocele. Spina bifida is a neural tube defect that can be caused by the protrusion from a meningocele. Colopathy. The resident could determine that the patient is suffering from some sort of colon disease or colopathy but requires more testing. Ileostomy. To let the small intestine recover from the operation, the surgeon performed an ileostomy to divert food. Pancreatectomy. Due to the malignant nature of the tumor on the pancreas, the physician advised a pancreatectomy to the patient. Hemolysis. An unknown virus is posing to be deadly as it carries out hemolysis in the host. Rhinorrhea. A common symptom of the flu is rhinorrhea, but it can also be due to an allergic reaction. Arteriosclerosis. Due to an excess plaque buildup, many of the patient's arteries display arteriosclerosis. Narcolepsy. The lack of orexin, which regulates wakefulness, causes narcolepsy. Analgesia. Prior to surgery, patients are given drugs to induce analgesia. Diaphoresis. Endocrine conditions such as hyperthyroidism and diabetes can cause excessive sweating or diaphoresis. Cephalectomy. Cephalectomy is a theoretical medical procedure as it means to remove the head or decapitate. Encephalopathy. Due to a hard football tackle, the player suffered a concussion and encephalopathy.